ACT is a really big topic, and we've done some different, I mean, I've been to a couple conferences on it. I know we've been together to a couple like 5-day intensive trainings. It still just takes a lot of time to kind of like wrap our head around it. I don't feel fully qualified to just say I know everything about it at all. But the stuff that kind of stuck with me and the parts that I do use, I think are really helpful. And it really does help to like go beyond the typical, ABA stuff. And I've used it with a couple learners who are more capable of, higher level thinking and self-awareness. ACT people would say they don't need that, but that's where I'm kind of like, I don't know how you do it without. So one of the things that we'll go through with some of the learners, even with some of the parents, although I do feel like you need to get permission for that, but one of those things that they call is the matrix. So ACT refers to a lot of like pieces of the hexaplex, and someone who's psychologically flexible is healthy, and they have a lot of like healthy habits, and they show a lot of the good parts of the hexaplex. And then the hexaplex also has those opposites. So you could be then that would make you psychologically inflexible, meaning like if you are able to give an example. If you're able to accept certain things, so that's the acceptance piece of the hexaplex means that you're able to accept that, well, I'm going through a really hard time. It's really hard. It's really challenging. I don't like whatever's going on. Then that's acceptance. Versus if you're showing not the non-acceptance, you're going to have a really hard time going through this because all you're doing is, well, it's not really happening, and I don't believe it's happening, and you're not accepting what's really going on. So that's like one example, and that's the hexaplex. They want to show like flexibility with all of those different pieces, with being able to show diffusion, so knowing that your thoughts are not you, with being able to show committed action, so taking actions that are going to get you towards your goals, with having values. All of these things just are different pieces of what they call the hexaplex, which is essentially psychological flexibility. So now the part that like I think is more practical and most useful is what they call the values matrix. So I'm just going to pull it up here, and the matrix, what you can do is help someone see that their actions and their behaviors are taking them further away from what they value. So I've done this sometimes with an older student who really wanted to make friends, and he had a really hard time making friends because he would do some like these repetitive behaviors, like they weren't allowed to chew a certain way, and he would get mad at them if they were chewing a certain way, or he would get mad at them, and then they have to say sorry a couple times. And it was just this whole repetitive process that was like not bringing him towards his values, and he didn't understand how those were connected. So you start here at the bottom corner with values, and you would start having the conversation of saying, well, what do you value? And obviously it takes a little bit longer than this, but if you're going to if the student values having friends, having relationships, having people like him, great. So you write that down in the matrix. This is what you value. Now you move on to the lower left quadrant here, and we're talking about, okay, what are those thoughts and feelings that are bringing you away from your value? So the things that are bringing you away from your value is, well, thoughts that someone's not nice to me, or that person has to apologize, or I don't like, it's annoying when they chew that way. So those are thoughts and feelings that take you away from your value because they're not building that friendship and that relationship. And then we can move on to, well, those thoughts and feelings turn into behavior. So when you yell at your friend because they're chewing a certain way, that's not bringing you towards your values. So, and people are seeing, so this is the part that's observable and measurable. This is the part that you could then work on as behavior analysts, reinforcement and punishment and shaping, and all that stuff comes up here. The behaviors that you don't want to see more of. So these are the behavior reduction goals. Those are the ones that are going to bring you away from your values. And then we can have the conversation of, well, what behaviors can we do that are going to bring us towards our values? And this is where we talk about, in our terms, replacement behaviors, behaviors that you want to see more of or increase. So obviously the top two quadrants we are always way more comfortable with, because it's very easy for us to identify behaviors to reduce and behaviors to increase. But there is something to be said for using those bottom two quadrants, right? Because private events are still behaviors. And if we're just focusing on the observable behaviors, we're missing a whole chunk of the things that are going on in a person's mind. And maybe they don't really care about having friends. And then is this a behavior that they're going to want to work on. And then it comes down to, like, we do so much about external reinforcement and external motivation, that if we're not really identifying those internal motivators, we're not really going to get true generalization and true mastery. So I think it is a good exercise to do with those learners. It also applies to parents. So sometimes, like, for example, the parent with the question we had earlier, the parent, I don't know why they're getting ABA, but maybe this parent values ABA, or maybe they value that their child receive therapy and become caught up with their peers. So values usually can be more long term. Like, you want your child to be in a regular school with typical peers. Let's say that was what the parent valued. Maybe they don't see how they're getting from here to there, but that's what you're going to show them. Because in step number 2, you're going to say, well, they really need to get this therapy, and the thoughts and feelings. So maybe your thoughts and feelings are, well, it's too hard. Like, there's so much work and I don't have enough time and my day's so busy, and it's just too hard. Like, when he tantrums, I just want to give him what he wants. Sorry, that's the behavior. That's the behavior part. But the thoughts and feelings are, it's so hard, it's so challenging, he's so little. And then the behaviors that are moving you away from your values might be those things. Well, you're giving into the behavior and he's tantruming, and you're not generalizing the skill and you're not following through. And that's going to bring him away from, we're losing time, and he's not going to be in a regular school if we can't work on this. And then coming up with some behaviors that you can work on to improve, to work towards your values. Well, let's pick something small. And this is where you get into something that's more short term, that we can work on to get to our larger value of what can we do in the short term to help us work on the behaviors that are bringing us towards our values. And it's constantly reevaluating and having those conversations. And they talk a lot about different functions of behavior. So identifying what this individual's function is. Sometimes it is escape, but it's escape from private events. Sometimes it's or some of the other ones, like diffusion and avoidance. Like, those were all different types of functions that are more private events than actual attention-seeking functions. Those, I feel, got a little bit more complicated in terms of identifying, like, what the function is of their specific, action that's bringing them away from their value. But even if you can't get to that level, I think that this is still a worthwhile activity.
We did this activity right after we came home from the conference. I did this activity with my staff. And it was really, really great, because a lot of us were suffering from burnout. And, we were frustrated, we had difficult clients, et cetera, et cetera. So during a staff workshop, we did this, and we just did it as a group. And we said, listen, like, write down privately, what matters the most to you? Why did you get in this field to begin with? Why are you doing what you're doing? And it was really, really nice to see that, right? Like, I'm getting in this field to help kids. I want to help the parents. I want to, make progression, make meaningful change, blah, 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 blah. And then, like, what thoughts and feelings are moving you away from that? Well, negative behavior. I feel defeated sometimes when I get beat up, obviously, when parents say this or blah, 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 and then we went through it all, and it was a really, really, really worthwhile exercise. So, even doing this with your staff would be nice, or doing it with yourself. Sit down and be really honest with yourself and pick one thing, one value that you want to look at and say, okay, I'm going to do it with myself, and get comfortable with that. And it's definitely a worthwhile exercise. Like I said, Shira has delved into it a lot more than I have, but it's really great. So I was just looking up where to find it on our drive. If you look on helpful resources and then you scroll down to other ABA techniques, you'll see it there. There's this, as well as the ACT, Hexaflex, etc. We haven't done a great job of explaining it because it's overwhelming, and you could probably explain this for days on end and still not be perfect with it, right? But anyways, it's there if you want to take a look at it.